A successful Florida businessman says he has a remedy for the nation's health care crisis. Harris Rosen tells us he has found a way to provide health care for his workers while saving millions of dollars and avoiding Obamacare. Griff Jenkins hit the ground in Orlando.
Greta, here in Orlando, Florida, visitors can't help but notice the sprawling hotels and resorts owned by Harris Rosen, like this one behind me, Shingle Creek. Mr. Rosen not only created a hotel empire, he also launched a self-funded insurance program for his more than 4,000 employees that he says has saved the company more than $200 million since the early 90s. Under Rosen Care, the average monthly premium for employees is $60 with a maximum deductible of $1,000. The company pays the rest. By comparison, under Obamacare in Florida, the lowest a person would pay for a premium is $96 with a deductible of 40% of your health care costs.
We've had our own medical center now for about 25 years. And we have a multitude of programs that demonstrate, I think, clearly and unequivocally to our associates how much we care about them. We love them dearly. This is a family facility. We take care of our own family members. And so if folks are overweight, we take care of them. Weight Watchers is free. We have special programs. We have nutritionists. We do podiatry here. We have radiology here. We do mammograms here. We have a beautiful fitness facility here. Anything to keep our associates healthy. And you know, that's the primary purpose, to keep everyone healthy. But you know, when you do good things, God rewards you. And so in the 25 years that we've been doing this, our health care costs have stayed at a relatively low level. Whereas the national average has gone up 5 or 10% a year. And so we have saved over the years about $220 million when you compare our costs with the cost, the healthcare costs, national averages.
Compare, if you will, for me, Rosen Care to what is now known as Obamacare.
Well, it's so incredibly different because they're part of the family here. They know the docs here. They know the nurse practitioners here. They know everyone behind the desk. They feel comfortable coming here. And it's part of their family. Obamacare, you never know who you're going to get. So when they say you can keep your doctors, well, that's not true. If the employer has to pay the fine, where are you going? You don't know where you're going. Who are you going to see? You don't know who you're going to see. How far away is it going to be? You don't know where. This is here permanently. And they could come anytime they want. And when they come, they remain on the clock. If they don't have a car, we drive them.
It's all on you. This is costing you.
No, it's not costing me anything because these are my family members. I love them dearly and I want them to be healthy. Listen, I believe that health care is a right. I think that everyone in the United States of America who works should have health care. They should. And I know some of my friends are saying, oh God, Rosen, you're going crazy. No. But the government can encourage them to do it by offering certain tax advantages. So if I provide health care and I'm a little business and I'm struggling to make a profit and the government says, Mr. Rosen, if you provide health care for your 10 or 15 or 20 employees, I'll tell you what we'll do. We'll give you a tax credit up to $3,500 per covered life. And now you've solved the problem. You don't need Obamacare. You don't need Obamacare because you've got every person who works will be covered, and encourage the employer to provide coverage by giving them a little incentive.
If you could offer advice to President Obama, for whom this is his signature legislation, what would you say to the president?
I would say, Mr. President, come and visit us. Spend a day with us. And just take a look at what we've done. And then you're going to say to yourself, gee whiz, we avoid all of this controversy, all of this political fuss, all of this nonsense that's going on, because I will encourage every owner of every business, every employer to come down and take a look at what Rosen is doing and replicate it. And the government will take a step backwards. We'll do Medicare, Medicaid, although I believe the states can do a better job of that. But still, the government has a role. But let the employer, whose responsibility is to take care of his employees, let them be the sole provider of health care in the United States of America. I understand the philosophy behind affordable care, which is we don't want anyone uninsured. We don't want anyone who can't afford to go to the hospital, go to see a doctor. But with the Rosen program, if you're working, that's going to be taken care of because it'll be mandated. And it has to be mandated because everyone who works should have insurance. So philosophically, I agree with the president completely. Health care needs to be changed. It's broken. But we can fix it in ways other than creating this huge government mandate, which isn't going to be able to provide good care at all.
Coming up, she's at the center of the IRS scandal.